When it was first announced that the novel coronavirus arrived to the United States, it was recommended that individuals should protect themselves and others by wearing a mask due to the increase in infection and mortality rates associated with COVID-19. This created a state of panic and mask shortage, leading to citizens quickly getting creative in the type of protective equipment that they wore. Some tutorials appeared online and were even presented by members of local and federal governments, instructing individuals on how to make a mask using household items such as socks. Soon enough, mask wearing became to be the new social norm. But according to the CDC and World Health Organization, during the initial stage of the pandemic, wearing a mask alone was not enough to combat the new and unknown deadly virus. In addition to wearing a mask, maintaining physical distancing was required as an added precaution to reduce the spread of the COVID-19 virus. Social distancing compliance and mask wearing felt like a roller coaster to many. The novelty of this strain led to constant changes in the recommendations put forth by the CDC and WHO. This uncertainty led to some individuals over-complying to mask and social distancing requirements, but it also led to other individuals protesting the physical distancing requirements implemented. The mask mandates led to protests where individuals voiced their disagreement with mask wearing requirements, and also individuals protested social distancing mandates that led to the closure of schools and many businesses. While some protested the new social distancing norms, this seemed to be appearing overnight. Others were more willing to follow this new social distancing norm. Social norms are rules defining appropriate and inappropriate behavior in a given society or nation. From previous research, we know that there may be some shared neurocognitive mechanisms underlying working memory capacity and social norm compliance in the prefrontal regions. Working memory capacity is defined as the number of items a given person can keep in mind over a brief period of time. It is closely related to the prefrontal mental processes, which involve cognition, cognitive control, which are a process of maintaining focus on goal-directed behavior and ignoring distracting information that is not related to one's goal. Working memory capacity is also closely related to prefrontal mental processes, which are involving decision-making. Like working memory capacity, social norm compliance has also been related to the prefrontal region, where studies found that stimulation over the prefrontal cortex can improve social norm compliance. In relation to social distancing and mask wearing compliance, we as a society are learning a new social norm without having any prior knowledge or repeated exposure to it. This new social norm seemed to just happen out of nowhere, and core cognitive functions such as working memory play an important role in social distancing and mask wearing compliance. Therefore, in our first study, we were interested in investigating how are core cognitive functions, namely working memory, associated with individual differences in social distancing compliance during the early stage of the COVID-19 pandemic. Participants in our study completed a visual working memory task where they saw 5 colored squares in the first display, and followed by that, they had a test display where they saw 5 more colored items, 4 of which were repeated colors, and 1 of them was a new color. Participants were asked to select the square where the color was different or new from the initial study phase. Participants also completed questionnaires assessing social distancing and mask wearing compliance and mood-related covariates such as depression, anxiety, and sleep quality. We found that individual differences in working memory capacity could predict social distancing compliance, and this relationship remained even after we controlled for socio-demographic variables, mood-related variables, and fluid intelligence. In other words, we found that individuals with higher working memory capacity were more likely to follow social distancing and mask-wearing mandates. This relationship is interpreted to be partly due to the increased awareness of the benefits over the costs of social distancing and mask wearing among higher working memory capacity individuals. Choosing to follow the social distancing norms and putting the societal benefits over the personal cost was contingent on working memory capacity. I would like to thank my PI, Dr. Wei John, and my collaborators. I would also like to thank all of the sponsors of the Multimedia Science Communication Competition.